BCG, also known as Bacillus calmette the guiding light. Okay, there we go. BCG and its mechanisms. In some diseases, BCG treatment can be classified as a gold standard treatment, especially in the diseases such as chronic cancer in the bladder or breast, for example. This form of treatment is considered to be very effective for high-risk, non-muscle invasive conditions, and it is used to prevent disease progression or reoccurrence within the body. From several studies and clinical trials, it was determined that there is a prominent inflammatory response which involves various steps after the vaccine has been administered to a human being. What are these steps? BCG involves steps such as the attachment of the BCG to proteins such as fibronectin attachment protein, also known as FAP, within the body. At the inoculation site, internalization of the BCG into the resident immune cells within the body, such as CD4 plus and CD8 plus cells, as well along with tumor urothelial cells and even normal cells, take place. Once this has been done, the BCG thereafter produces mediated induction of innate immunity, which is facilitated by a cytokine and cellular melee along the BCG mediated tumor-specific immunity. To add more depth and complexity to the reaction, a variation between clinical strains of BCGs might have an overall effect on tumor immunity within the body. As you can see from this diagram, once BCG enters the body, it attaches itself to urothelial cells, also known as fibronectin, which is a protein within the body. And then internalization takes place at the bladder cancer cells, such as a macrophagocyte, such as P10 and RAS. Thereafter, the antigen produced by the BCG presents itself, and the cytokine released by the bladder cancer cells uptakes with MHS2 upregulation. Then immune cell recruitment will therefore take place, making use of granulocytes, CD4 lymphocytes, CD8 lymphocytes from the lymph glands, along with NK cells and macrophages. Thereafter, mass cytokine production will take place along with using TNF alpha and delta IFN. Immune-mediated cytotoxicity therefore occurs afterwards, killing the cancer cells and processing dendritic cells. Strains of BCG. BCG is widely used around the world and distributed. However, it's not massively distributed in the USA, but there are several strains of BCG, such as the BCG Pasteur, which is French, BCG Russia, also known as Russia Moscow, BCG Brazil, Rio, Bulgaria, also known as Sofia, Connaught, which is Toronto, Danish from Denmark, and Tokyo from Japan. Some interesting facts about this. There are various types of BCG vaccines used throughout the world, as you can see from table 1. However, all of these are mass-produced and widely distributed, and the main ones being Denmark and Couture, which are considered to be the most effective and distributed. UNICEF is the world's major supplier of BCG vaccines, which uses strains from both Russia and Denmark. BCG vaccines are typically composed of various ingredients, such as the main ingredient, also known as the mycobacterium, which is the antigen used at a milder state, which has been actinated. So this causes a protein of the virus to be injected within the body, causing a not severe reaction, but a mild reaction that mimics the disease. And it also contains salts such as sodium, potassium, magnesium salts, citric acid, which is commonly used as a food stabilizer, and glycerol. Thank you so much.